Governor Steve Sisolak, thank you so much for joining us.
It's a pleasure. Thanks for having me.
What many people are talking about today, Mayor Goodman on CNN. What are your thoughts?
Well, I saw the interviews, and all I can say is the mayor and I disagree on this particular one. I mean, the welfare and the health and the lives of the citizens of the state of Nevada and Southern Nevada included, obviously, in that are extremely important to me. I would in no way ever want to use our Nevadans as a control group or as a placebo or whatever you're calling it. I don't think it's reasonable to ask someone to choose between their job and a paycheck and their health and their life. I mean, that's not a reasonable choice that you're giving people. No one wants to reopen more than I do. No one wants to get back to where we were, 6 months ago. And I want all the visitors that are out there to come back to Las Vegas, just not today or tomorrow. When the time is right, we will slowly and methodically open our communities back up. And when the time is right, we will welcome all the visitors back and have one heck of a party on Las Vegas Boulevard.
And part of her argument is that the numbers aren't high enough. What would you say to that? She's saying if you have people who can't put food on the table.
Well, the numbers, she's right, the numbers are low compared to some other states, but the numbers are low because we took early and decisive action. They're low because the citizens have taken part in this. They've done what we've asked. They've stayed home. They've worn face coverings. They've practiced social distancing. They have not gathered in large groups. They've not gone outside. We've got a stay-at-home situation. That's why the numbers are low. They worked so hard for 6 weeks to get to this point. I don't want to undo all the good that's done by opening a week or 2 weeks too early and suddenly have it all come tumbling back and undo all the good that we've done. I mean, we were at a point where at the beginning, people thought we'd have tens of thousands of deaths in Nevada. They thought there were 1,000 positive cases. Our numbers are low. There's a little over 4,000 cases, and sadly, 174 individuals have lost their lives. But it could have been many, many times that, and it's not because of what we did. That's not a reason to reopen right now. That's a reason that shows that it worked. The policies we put in place have worked. They're continuing to work. And when the medical experts and the scientists tell me that we've plateaued, we started on a downward trajectory, we will slowly open our economy back up. But that's not today.
When is the last time you spoke with her, and can you share more about that conversation?
I think the last time was early on in this discussion when we talked early on in the pandemic we're facing, when we talked about closing the schools, and I notified the mayors. I had the mayors all on a conference call and notified them. I don't believe I've spoken to her since then, but I can attest to this. A lot of the leadership in Nevada, in Southern Nevada, has been incredible. I've had great support from the Clark County Commission. I spent 10 years on that commission myself. That's who controls the Las Vegas Strip, and they are working hand in glove with me to improve the testing, to get more testing out there. I know the mayor said that wasn't her job, but I talked to Mayor March in Henderson. She's eager to help us on activating more testing.
Should Mayor Goodman resign?
Oh, that's not for me to say whether Mayor Goodman should resign. I wish she would reconsider what she said. I think that she is in a position as mayor that people do look to her for her guidance and for her opinion. I don't think what she is saying is helpful for the state and for the community as a whole, to encourage people that, that this is what we need to do. I wish that she would look more at the scientific evidence. She said she uses Dr. Fauci, but, I've spoken to Dr. Fauci in our calls. He is not advocating opening up now. I mean, he's the one that's saying, look, you're going too fast. People are going too fast. He's espousing views that are exact opposite of her. And I've got a good group of medical team and scientists that have assembled up here, and they're giving me good advice, and I rely on their advice. And I just wish that she would look at the science and look at the facts behind here and not just want to open up.
Now, as far as models and data, you referred to the data yesterday, but is there a number that you could say, we believe this would be our peak? Is there anything more you can share about that from your team?
Well, modeling is very complicated. It's very complex, and I'm learning more about modeling as we go. The last time I dealt with statistics to this extent is when I was in college, and that was quite a few years ago. You have to look at, you don't know what once you've reached this peak until after you've reached it. you see the numbers continuing to go up, and then they'll plateau, and then they might go up again, they'll plateau, and then they're going to slowly start going down. Well, you're not going to know that because sometimes you go along, you go up, and you come down, you go up, you come down, and you haven't started that downward trajectory. And that's what I think the White House is saying, certainly what Dr. Fauci and Dr. Birx are saying, that you need a consistent trajectory, that you've plateaued and you've come down. And that'll set you that, okay, now you're in a position where you can start to slowly open back up again. I look at very seriously the number of hospitalizations. I look at the number of intensive care unit beds that we're using and the ventilator usage, of course, but also what capacity is left. So in case we start back up again and then we have a surge, we've got hospital capacity in order to deal with all those individuals. And those are the kind of things that I look for.
Now, we know the stay-at-home order is through April. I think some people thought May 1st would be perhaps some light at the end of the tunnel. Are you saying definitively that could be extended and May 1st does not have a significance right now?
Well, I don't know what, that's the significance in terms of right now. That's when our directives all expire unless they're extended. No one would like to give you a date more than me right now. I'd love to tell you it's April 30th or May 5th or May 15th or whatever that date is. In good conscience, I can't give you an arbitrary date that I can't commit that I think we have a good chance of reaching. The science of this virus is going to tell us when we get to where our peak is. And my concern is not just Nevada, states that have tried to push that a little bit, that have tried to be a little bit too aggressive, can suffer a severe setback. And I would hate to open up a week or two early to cost us 3 or 4 months more delay when we have to shut it back down and say, okay, now we've got a massive spike again because we unlocked everything at one time. That simply won't work. When we hit a trajectory that you start seeing the percentage of positive cases versus the number of tests that we do going down on a consistent basis, and at the same time, you see an availability and surge capacity in the hospitals for hospital beds, then we'll know that, okay, we can start making small adjustments and do it a little bit at a time, open up a couple different business sectors and then a couple more and a couple more, at the same time continuing to practice the social distancing and the group gatherings and hygienes that we've implemented along the way.
How concerned are you about a second round of this in the fall?
I'm very concerned. I'm very concerned. And I'm concerned because people that are a lot smarter than me tell me it's something that we have to worry about. When the medical professionals are saying we need to be concerned that this could have a resurgence in the fall, I think that's even more evidence that we need to make sure that we keep it down as we move into the fall, because it could be problematic. And I think that we're going to see what happens in some of these other states. When you saw the things that Milwaukee, for example, I'm from Milwaukee, and they've done a lot of tracing there, and they've shown that several of the new cases are a result of the primary that they had just a few weeks ago, where people couldn't vote by mail, they had to vote in person. And several of those cases have been traced back to that. We need to expand our testing, we need to expand our tracing, and I think that'll give us more information to base these decisions on as we move forward. It'll be based on that science and those facts as opposed to just being eager and anxious, because I'm eager and anxious too, but it just in good conscience can't do it yet.
Unemployment. Just over a week ago, you mentioned that improvements were being made to the system. We are still getting so many calls from viewers saying, I think the biggest complaint is they still can't reach a human on the phone. What's happening?
Unemployment is a very complex and frustrating situation. I'll give you that. At the time, we figured about 5% of the folks are having trouble getting through. And those are usually based on, not that they can't get through, it's based on a complication of their claim. That they claim they were laid off, their employer claimed they were terminated, they weren't able to show past employment through pay stubs, through various things. Their name was typed different than it was on the checks, and it wasn't corresponding with something that somebody was paid under. We need to handle those on a one-by-one basis, and they're very time-consuming, and I've got a great staff doing it. Unfortunately, the staff is nowhere near as large as it needs to be to handle those sort of claims. As bad as it is, with the people that are having a problem, if you've got 1, 5, 10, however many people it is that have got a problem, that's a lot. But understand, over 300,000 claims have been processed properly. They're getting checks on a weekly basis. 300,000 Nevadans are getting that. Yes, there are several thousand of them out there that I'm worried about that we continue to try to process, and I encourage them to keep calling, to keep trying. Their benefits will be retroactive to the first date. They're not losing any compensation along the way, but I know they need the money now, and we'll continue to work with them and try to do what we can, whether that's adding more staff, expanding hours. We're looking at all of those things.
Just have a couple more questions for you. I tried to ask this at the press conference yesterday, but I had a bad connection. And
Yeah.
I just wanted to touch on it again. So schools are closed for the remainder of the school year.
Mm-hmm.
Distance learning continues, but for parents who gradually start going back to work, that distance learning is going to be an issue. Also, childcare in our state is expensive and hard to come by. What can you offer there?
Well, the school districts, my superintendent, Joan Evert, has done an incredible job communicating with all of our superintendents. Every district is a little bit different. Clark County is the monster. It's the huge one down in Southern Nevada, clearly, and is bigger than all the others combined by far. It's difficult for parents. It's difficult for parents to handle the tutoring, the distance education. We're working with our districts to try to address the situation of childcare as we move into phase one, and hopefully some people will go back to work. I can tell you they did an incredible job in terms of providing nutrition assistance for all of our students so that we could continue to get food in the family's hands, to provide computers or Chrome devices or laptops, whatever it might be, iPads for their distance education. And the educators have been outstanding. I mean, they're just really coming up with clever, fun things to engage the kids and to keep them participating and keep them involved. And those are all great things. And I think it's a tribute to our educators and our teachers and parents. I just want to say thank you. I know I'm going to go back to a safe school. You want to go back to a school where you don't have to worry about them, being infected, by having one of their classmates have been positive. And I think we shut down at the right time. If we'd have had an outbreak in a school, it could have been devastating. And thank God we didn't. But it's important that people know that they're doing a great job in terms of the distance education. Our educators are doing a great job, and hopefully this will all be water under the bridge by the time we get the next academic year.
Yes. Okay. I'm sorry. It's as we're talking about parents being home, my 3-year-old is back here. I'm sorry.
Does your 3-year-old have a question for me? I'd be happy to answer it.
He wants to talk about dragons. So
okay,
really
I know about dragons. Not too much.
All right, Gabriel. Mommy will be right there. I wanted to ask you one more question.
Okay.
Okay. All right, buddy. Thank you. I'm sorry. My last question.
Don't be sorry. Don't ever be sorry about your son interrupting.
I'm just following your order. I'm staying home.
Okay. So, good. I appreciate that.
This is my last question. So I talked with a mom a couple of days ago whose son, who's in his early 20s, she said he has COVID and he's in the hospital, and she can't be with him. And I think if you think about any loved one not being able to be with them in the hospital when they're so sick, that struck me. I know you're talking to families.
I am.
What strikes you here?
What strikes me, and I know that please understand, I'm getting pressured and pulled in a lot of different directions as it gets to this. When you talk to a family member that couldn't get into an extended care facility to say goodbye to a mom that was passing, or a wife that gave birth, that the husband couldn't be there when the wife gave birth, or even more close hitting, someone who lost a family member to COVID-19. And I've talked to those folks. And I've talked to our first patient, Private Pippins from, the veterans home in Boulder City. And we had a great conversation. And he begged me, he said, "Governor, please don't open up early." He goes, I want to see my grandkids. And his kids aren't even married yet. And he goes, "Please, it's so important that we continue to practice social distancing, that you continue to keep people safe." He says, "Everything else is going to be forgotten. But if you lose a loved one, you're not going to forget that." People are making enormous sacrifices right now. To imagine that you can't get into a hospital to say goodbye to a loved one you have that's dying is something that I can't even imagine. I can't even begin to imagine, to think that you can't visit, a family member that's in a convalescent center. I mean, I've been in Northern Nevada. I haven't been able to see my mother in 5 weeks. I mean, it rips my heart out, but, for continuing to participate in this, and we will get through this. We'll get through it together.
Anything you want to add?
No, I think that I just kind of poured it all out there in the end. I just encourage everyone. I want to thank everyone for continuing to follow the directives, to staying home, to practice social distancing and good hygiene, and we'll get through this together. In the meantime, please stay home, stay safe, and stay healthy, and we'll be through this together, and hopefully it won't take too much longer. But thank you.